a new treatment for the herniated disc with Dr. Dennis Spoonhour.
Hi, my name is Dr. Dennis Spoonhour, and today we're going to be talking about herniated discs. A lot of my patients come to my office with herniated discs, and the first thing they ask me is, Doc, what exactly is a herniated disc? First, a herniated disc can be very, very painful, and when you have a herniated disc, it can stop you or inhibit you from performing your normal everyday activities. Some people have a hard time tying their shoelaces or putting on their socks. Some can't even bend or lift or play golf. So a herniated disc can be a very serious condition.
I hurt my back reaching just for the remote control, my TV control. And it was so bad that I couldn't get up. I had to lay down, and once I laid down, I couldn't get up. That's how bad the pain was. 911 came in, and they had to literally lift me up and put me into a stretcher and take me to the hospital.
My back is hurting because I've been playing soccer for so many years and falling down hard to the ground. And then lately I was helping my nephew with his hydroponic project. And it had a little hurt, feeling, and the next morning I couldn't get up.
This is a life-size model of exactly what a spine looks like. If you look right here, these individual segments are called vertebrae. There are 24 of them in your spine. These little yellow things coming from the sides here, these represent the nerves. And if you look between them, you can actually see a little hole where the actual nerves are coming out of the spinal cord. What's in between these two bones right here, this little jelly-filled center, is called the disc. This disc is made up of a cartilage that acts like a shock absorber so that the bones never touch. So you can bend and jump up and down and the bones don't slam together. So a herniated disc is basically this example right here. This little red thing coming from the spine, like if you had a jelly-filled donut and you squeezed on it, some of the material would come out from between here. That's basically what a herniated disc is. It's a protrusion of some of the disc material. Now if you look at this, you can actually see where it presses on a nerve coming from here. The next most common question patients ask me is exactly what causes a herniated disc. There are three types of injuries that can cause a herniated disc. Number one is falls. Number two is improper lifting. Now with improper lifting, the cause of the herniated disc is the lifting, the bending, and the twisting motion. Number three is automobile accidents. These are the three forms of injuries that can cause a herniated disc.
I had a C5, C6 herniation from a car accident I got rear-ended in. Before the accident, I used to do a lot of mountain biking, a lot of lifting for my job, for what I do, and generally slept pretty good through the night, things like that. And after the herniation, just had an extreme amount of pain, some radiating pain down my shoulder, the back of my arm, and just like a very, like a hot, searing poker pain in the back of my neck from the herniation.
The next thing patients tend to ask me is how do doctors of chiropractic exactly correct a herniated disc? Now there's a new state-of-the-art technique that I use called spinal decompression therapy. I'm lucky enough to be one of the few doctors in Florida to have this new equipment. In my office, there's a 90% correction rate with this new therapy. It's non-drug, non-surgical, no anesthetic is necessary, and it's very successful.
It's very important for me to move without pain because now I'm able to work, and if I couldn't, then I wouldn't be able to pay my bills or continue with my life.
The next thing they tend to ask me is what techniques were used in the past to actually correct a herniated disc. They used heat, hot packs, ice, ultrasound, electrical stimulation, drugs, or surgery. These are sometimes used today, but none of those things will actually get the disc back into its proper position. All those forms of therapy I listed just treat the symptom, trying to get you out of pain, but they do not correct the cause of the herniated disc. What I do with spinal decompression therapy is more than work on the pain, but actually help correct the herniation so hopefully it won't come back again.
It is wonderful. You feel like it stretches you. It actually feels like your muscles, your lower back is being stretched to such a point that it feels like you have relief in your lower back. And you feel like you're a lot taller as you're being stretched. And it's just a machine that I never knew existed.
What I want to do now is show you exactly what spinal decompression therapy is and how it works. What we do is lay the person down on their stomach, and to get the herniated disc actually back into place, what we do is distract the spine. What that does is open up the joints and the disc will go right back into place. When the table does this decompression motion, it opens up that joint and the negative pressure actually creates a vacuum which allows the disc to be corrected back in the normal position. By using this procedure, there's a 90% response rate in correcting herniated discs. Again, it's very safe and very effective. Another question patients ask me is, how do you know where the herniated disc is? There's a special diagnostic test called an MRI that will actually show us where the herniated disc is, how big it is, and the exact location. With that information, we know precisely where to distract that spine to get the disc back in place. A lot of patients always ask me about surgery. They always hear that when you get a herniated disc, that surgery is an option. I want to tell everybody right now that surgery is a very dangerous procedure.
Well, the reason I looked for the alternative is because I never have really liked to take a lot of pain medications. They tend to make you tired, make you groggy, and I'm not one to take a lot of medications in the first place. So that was a big reason. And then, I've had my fair share of surgeries. I've had a shoulder surgery and maybe a knee and a couple other surgeries too. So it's just best to do I feel like a non-invasive type of a alternative first, and maybe as a last method, maybe a surgery. But I really want to avoid it if I could.
If you look at the spine again, it seems logical that if you have a disc bulging out and or it's herniated, going in there with a knife and cutting off that bulge would be the normal thing to do and a viable solution to the problem. The only problem with that is when you have surgery, all this tissue, when it actually starts to heal, it heals with scar tissue. And when you have scar tissue on your spine, that joint and that area will never be as strong as it was before. The other danger is that the surgeon, sometimes the knife might slip and cut a spinal nerve, causing permanent paralysis. In the United States alone last year, there were over 500,000 back surgeries performed. Of those 500,000 performed, over 53% were deemed failures. The medical profession actually has a name for that. When you've had a back surgery and it's a failure, they call it failed back surgery syndrome. It's very common, very prevalent, but most people have never heard of this before. But that's what they call it when surgery fails. When you go into surgery, you're taking a chance. Now, what my job is as a chiropractor is to correct this naturally without having surgery done. So that's why spinal decompression therapy is such an important and a viable solution to get all this stuff corrected without having to go under the knife. The last thing that patients ask is, how long does it take to correct a herniated disc when you come into my office? It all depends on the person's age and their occupation and the severity of the herniated disc. Now, the typical patient can expect to get a 50% improvement in the symptoms of the herniated disc within the first 30 days. And if they don't, they will be referred to the proper specialist. They also like to know exactly what kind of frequency they need to come into our office to get this corrected. Most patients need to be seen on a 3 times a week basis for a minimum of 1 to 3 months to correct their herniated disc once we found out where it is. Herniated discs are very painful and debilitate patients easily, but spinal decompression therapy can correct it non-surgically, without drugs, and without any kind of anesthetic at all. It's a very safe and viable option for patients, and it can prevent them from having something more serious done.
Decompression therapy was the best for me because surgery is scary. And the actual idea was there was no sure thing with surgery. And when they put me on the decompression therapy and I saw the results the very first day, it was like a miracle. And the next day when I went on it again, it was like, oh my God, I feel good. It was like I couldn't believe it.
If you've been told you have a herniated disc, or think you might have one, or know anyone else who does, and you're afraid of taking dangerous drugs or having surgery done, let me invite you to come into my office and see if chiropractic can help you. Here's how to get more information and set up a consultation to see if you will be a candidate for spinal decompression therapy. I'm Dr. Dennis Spoonhour.